Good morning, good Saturday morning to everyone, and welcome again to the third edition of the Community Conversation on Lung Cancer. Today's theme is going to be receiving personalized care and treatment that fits your lung cancer diagnosis. We've had two amazing weeks or two amazing workshops of this phenomenal series, and we have some amazing clinicians, urologists, testimonies. It has been overwhelmingly positive in our community, and thank God for all of you that have taken out of your time to be with us today. We've heard from you. We've heard from you from Canada. We've heard from you down in South America and in the islands. I am so grateful and thankful to God that you have chosen to be a part of this, because information and education matters. It matters because lives are being changed, hearts are being lifted, and the burden of carrying the load of lung cancer and its diagnosis and its related diseases is being lifted off of each individual and being carried by the community. And so sit back, relax, and tell your friends. If you have Facebook, if you have Instagram, please note to your friends that we are on and we are about to give some information that could very well change your life. Will you take a few moments with me and bow before the Lord as we go into our opening prayer for this amazing workshop? Father, we thank you today. We thank you because you rose us up early this morning and our minds were stayed on you. This is the day that you have made, and we are rejoicing and are glad in it. Lord, there are people that are on the line today. There are participants that are on the line today that are going through the challenges of lung cancer and its related diseases. Oh God, we know that you're able to do the impossible. And so we ask, God, that you will speak through our voices today and reach and meet each individual at the point of their need. Oh God, where there's healing, move. Where there is deliverance, move. Where there is sadness, bring it back to joy. Where there is pain, heal today by your Spirit, and we'll forever give you the praise, the glory, and the honor. It's in the matchless name of Jesus Christ we do pray this prayer and ask it all. And everyone that agree, let's all say amen, amen, and amen. It's an exciting Saturday morning. And this workshop, we want you to know that we're going to do some giveaways. We're going to do some giveaways, some Walmart gift card giveaways to each individual or individuals who have registered. There will be a drawing. All you have to do is register at Impact Church, East Point, Georgia, .breezechms.com. Look for the form or click on the button there on the screen. You can also register or be involved by liking the Hill Collaborative Facebook page and sharing this live stream with your friends. At the end of this workshop, we'll give more information about those giveaways, and the winners will be notified at the end. So good luck. And I know that you will be blessed. Well, I don't want to hold us up. I don't want to waste any time, because if it's anything like the first two workshops that we've had, this is going to be informative, exciting, and life-changing. Are you ready for your life to be changed? Are you ready to be lifted? Are you ready to learn more? So sit back, call somebody, text somebody, let them know that we're on and we're about to get started with this amazing workshop. I want to, before we go any further though, I want to recognize our sponsors. Impact Church is honored to be in partnership with Amgen, Hill Collaborative, Morehouse School of Medicine, Grady Hospital Systems, Northside Hospital Systems, Emory Hospital Systems, and all of our other amazing sponsors. Thank you for coming on and walking with us, leaning in to this most worthy cause. And we're going to do more. We're going to do more. You're going to hear more information about our upcoming workshop on September the 30th. I want to mention it right now because throughout this series or throughout today, you're going to hear more about it. It's going to be a hybrid, both live and virtual, live on the campus of Impact Church right here in Atlanta, Georgia, 2323 Sylvan Road in East Point, Georgia, just south of the city. We're going to have a live radio broadcast that is going to go throughout the Southeast region. We're going to have phenomenal speakers. We're going to have policymakers. They're going to be legislators that are going to be on campus taking your questions and giving answers to what we're going to be doing from the legislative or the policy making perspective. Then we're going to have some amazing testimonies. If you are in the metro Atlanta area, I wouldn't miss it because it's going to be a time of fun, fellowship, and faith where we connect ourselves and give information to our community. Yes, there are going to be giveaways. We're going to have food, popcorn, and ice cream, and all type of wonderful food that will be offered to you free of charge. There is no cost to you. You just need to get there. Again, that's on Saturday, September the 3rd from 11 o'clock to 3 o'clock, the fourth installment of a community conversation on lung cancer. And that is going to be amazing. I can't wait. I'm so excited. I'm about to blow my lid. So with that being said, let us get ready now to start the workshop. And we're going to bring on our first guest. This panel discussion will be a provider panel. And so our guests are amazing in their own right. They've done some great things within the community. And so we're going to bring them on. Dr. Fadal and the others will come on now. And let's get going. Dr. Fadal, it's good to see you, my friend, for our third workshop. I want to tell you, man, you're getting a following. You're getting a following. I get comments during the month about who is that doctor and why is he, he give out so much good information. Well, why is he not on the Impact campus? So I want to see you, Dr. Fadal.
Got you. Looking forward to it. I'm looking forward to it.
To have you again, my friend. I leave it now to you. Thank you.
Got you. And I have a few slides just to kind of help me keep track of things. And so today's focus is we're going to talk about biomarker testing. And I really wanted to sort of narrow in on this and sort of give everybody an overview because this is something new. And when you say biomarker testing, not everybody may be familiar with exactly what it is and how it might be helpful. It can get pretty complex in some aspects, but I want to give you an overview so that when patients go in, that they're informed, that they know what to ask for, that they have a general understanding of what they're requesting when they get it and how it may impact their treatment and therapy. Next slide. So let's talk about this whole biomarker testing and driver mutations. You're going to hear a lot of big words and acronyms and whatever else, but let me break this down pretty simple. So driver mutations on the DNA of the cells, of the cancer cells, those are what helps it sort of form in its tissue structure and grow, thrive, and help create its own mutation. And so the mutations in the DNA of the cancer cells are what's triggering all this. It'll help the cancer cells build their own networks of blood supply. It helps them determine how fast it grows and spreads and thrives throughout the body, right? And so as medicine has moved along, we've been able to identify where these specific areas on the DNA of the cancer cells are and what these mutations are that are driving the cancer to thrive, grow, and whatever. And I want to get this concept across because if we know exactly where that occurs, then we can come back and say, how do we attack that? and stop it from growing, stop it from creating its own blood supply, stop it from thriving, basically cutting it off at the stem. And so we do this by biomarker testing. And these are tests of either your blood or the actual cancer tissue to look for these levels or these presence of these drivers or these proteins that give an idea of what the mutation is that's making this cancer grow. Next slide. Okay. So how does it help? So we know that not every person that has cancer is going to have the same behavior of the cancer as the next person. So as you go through that, you start thinking, well, how do we find out the unique characteristics of each lung cancer for each patient and really personalize, target the therapy for that specific person and give them a better outcome? And again, we're looking at doing this so we can go back and attack the cancer's ability to grow, the cancer's ability to make its own blood supply and feed itself, and its ability to thrive and to spread. So by testing for these biomarkers through either the blood or the tissue, physicians can pick out a treatment that targets that patient's specific cancer. So it's individualized. They're getting focused treatment for their specific problem. And then biomarker testing also helps the physician track the response to treatment. And if the cancer comes back, they can go back and look at these markers again and determine whether or not there's another mutation, if it's changed. A term that might not quite fit, but you understand a little more, is whether or not the therapy that the person was receiving for the cancer treatment has the cancer has become resistant to it. Might be a better way to say it. Next slide. Okay. So patients that qualify for targeted therapy have better survival rates. And we know this, studies have shown this. If you think about it, it's not, not one size shoe fits all people, right? But you know that if you have a shoe that is fitted specifically for you, you're going to walk better, you're going to talk, you're going to move around better, you're going to have less pain, it's going to be more comfortable for you. The same thing with cancer. We can give one type of chemotherapy, one type of radiation, and you're just kind of hoping that it's going to be beneficial, that the side effects are going to be not as bad, but you never really know how that works for each individual. But we do know that if we can target for the specific type of cancer, then they're going to have a better outcome. They're going to have better survival rates. And the studies have shown this. And the patients that do qualify for targeted therapy means that actually have less complications, less side effects than the standard chemotherapies. And so when we talking about targeted therapy, we're talking about treatments where we stimulate the immune system, or we use the immune system to help fight against some of the cancers. And help target out some of these specific markers on the DNA or the proteins that the cancer is expressing. So only the cancer is getting attacked and not the rest of the body. Some of the common mutations, and for your sake, and for a patient's sake, you really don't have to have all of these memorized or know them, but know that there's 5 common ones that we found that are really helpful in identifying. It's the EGFR, ALK, the KRAS, ROS1, or PDL1. And those are ones that you don't have to memorize, but if you do have cancer, you should hear your physician talking about these ones and that they're testing for them. And if they're not testing for them, you need to ask them, are you looking at biomarkers? How do I find out if I have them? Do I have the ability to get targeted therapy for my cancer? Next slide. Okay. So who should have biomarker testing? Okay. So hard recommendations for biomarker testing are: if you have stage 4 lung cancer, which means at the time you're diagnosed that cancer has spread to other parts of the body, then you should be somebody that looks for biomarker testing, because that cancer has shown that it can already spread, build its own blood supplies, and thrive. And getting a head start by attacking its ability to spread more would be most helpful. For patients that have received, some sort of treatment or therapy or chemotherapy, and then they come back and they find that the cancer has gotten worse or has spread, that's somebody you should look back and say, okay, let's look for these biomarkers again. Was there another mutation in the cancer cells that's allowing it to be resistant to some of the treatment that you've already received? And then again, if you've never been tested at the time of diagnosis for lung cancer, then that's the time to test. Because even though you may have an early stage lung cancer, which could be taken out with surgery and completely cured, we know that having lung cancer at one point in time in your life puts you at a risk for developing it again later. And it's just best to say, we know what the type of cancer that they're developing is, and we know what the biomarker structure is. And if it comes back, we can start looking at targeted therapy. And there's some recommendations that biomarker testing may benefit all stages: stage 1, stage 2, stage 3 lung cancers, as well as stage 4. So what we're starting to see as this science improves and we go through time, that this may be the way of the future here in terms of improving the outcomes for lung cancer. Next slide. Okay. So what about biomarker testing in African Americans? Well, we know, and if you've been part of the these earlier talks, you know that there are disparities for African Americans in lung cancer. They're diagnosed at later stages. And when I say later stages, it means at the time that they're diagnosed, it's already spread the vast majority of times. They have longer waits for treatment, okay? And they have lower survival rates. And so you think about this: if you can get targeted therapy for those patients that are diagnosed with later stages, those stage 4s, and you can get this through blood work, and the blood work can give you a treatment therapy, a knowledge of a treatment therapy earlier in the course of deciding what they're going to receive, that this biomarker testing and targeted therapy may have a big impact on decreasing the disparities for lung cancer with African Americans. And we already know, as I mentioned earlier, stage 1 lung cancers, those are some of the easiest ones to treat and balance out therapy across the board, because surgery is primarily recommended for early stage 1 lung cancers. And studies have shown that no matter what race you are, no matter what sex you are, when you get equal treatment for an equal stage of cancer, that the disparities go away. So they found when African Americans got early treatment for a stage 1 lung cancer, that the survival rates were the same across, for compared to whites. However, we don't know that yet for the targeted therapy, but this holds promise here, that if you can get biomarker testing, get targeted therapy for those late stage ones, then it's a good chance that those disparities will decrease. The problem is only 14% of Blacks receive biomarker testing versus 26% of whites. And this may be twofold. One is the healthcare providers, ourselves, myself included, need to really focus on making sure that we are testing African Americans as well as anybody who has lung cancer for these biomarkers. The other thing is from the patient side, that you are empowered with the knowledge to go back and ask, are you testing me for biomarkers? Am I a candidate for targeted therapy? Because we know that equal treatment decreases disparities in early stage lung cancer, and it may do the same for late stage if you're a candidate for this targeted therapy. Next slide. Okay, so your key points: ask your physicians about biomarker testing. If you are diagnosed or you have a family member, a loved one, or a close person that's diagnosed with lung cancer, keep in their minds, refresh them. At the time they're diagnosed, ask about biomarker testing and their candidacy for targeted therapy. Do it for all stages, stage 1, 2, 3. Let them come back and give you the decision whether it's a candidate or not. If they're not testing for it, you might think about finding somewhere that might test you for it or give you the opportunity to receive this testing and treatment. Okay. If you have lung cancer already and it returns or it progresses despite treatment, then you should ask about biomarker testing. And finally, if there's a family history of lung cancer in your family, and especially women, and especially those who have never smoked, definitely you need to look into asking about biomarker testing and targeted therapy. And with that, I think that's my last slide, and we'll open it up.
Hi, everyone. Thank you, Dr. Fennell. That was a great talk. I am going to now be taking over on the advocacy panel. So my name is Dr. Sydney Barnett. I am an internal medicine specialist, and I am also a stage 4 lung cancer survivor and thriver. I also have a biomarker. My biomarker is ALK, and this is why this workshop is so important to me, because knowing my biomarker made the world of difference in my treatment. So I am going to be joined here with the Wendy Lindstrom, who is an oncology nurse navigator at Northside Hospital, Forsyth, and Angela James, who is a care navigator at Longevity. Welcome, ladies.
Thank you.
All right, so we are here to talk about biomarker testing. And one of the questions that a lot of people ask are, what is the most important questions that patients should ask their healthcare provider about getting a biomarker test?
Okay. One of the first things would be just that your healthcare provider, your oncologist, is familiar with your health history, the medications you're on, and any other health problems that you have. They will take into consideration these other health problems and referring you if surgery is going to be an option for you. Certainly that's going to figure into things, as well as the extent of the disease or the stage, like you mentioned earlier.
Angela, do you think there's any questions you can think of off the top of your head that you would tell patients to ask their providers?
Oh, yeah, definitely. Because one of the things that they worry about is what's the cost? Is there going to be any type of assistance available to be able to get the actual biomarker testing? So that's when someone like me would come in and be able to answer those questions as far as what's available to them as far as patient assistance program and helping them pay for the actual biomarker testing.
Right, that's true. Because one of the things that I remember when I got tested is I got a bill that was not pretty. And at first, my insurance company told me, oh, they're not paying for this. This wasn't necessary. And I was just like, what do you mean that it's not necessary? Thankfully, eventually that got sorted out. So, but the other questions, one of the other questions I have is like, why do you think that biomarker testing is not used as an early detection tool for anyone who is at risk for lung cancer or who exhibits signs and symptoms of lung cancer?
Okay, that's a great question. The preference is always to test the actual tumor. So if someone doesn't have a cancer, they wouldn't be able to find it. The other thing is that when someone has metastatic disease or stage 4, like you mentioned, that's the only time that we would be able to use a blood test to look for those markers. There would not be enough of them expressed to be picked up if it was not metastatic disease.
Okay. So main thing is, you need to have tumor, but granted, you can get tumor at any stage. You can get tumors, you can get biopsies at stage 1 or through stage 4. I mean, what I do know is that, stage 1, because stage 1 is curative, we try to just do surgery, and doing biomarker testing means that you're going to be taking these medications for life, which eventually is more palliative, trying to keep it treatment based versus earlier stages where the goal is a cure. So that makes a whole lot of sense. What would make a patient ineligible for biomarker testing, however?
There really isn't anything that would make you ineligible for testing, but there are considerations for whether you would want to take any of these medications if you were positive for one of the biomarkers. Certainly anything that affects your immune system, you would need to be monitored, and likely your oncologist would need to work with your other doctor who's helping you with that condition.
Okay. Now, Angela, like you were talking about the costs, like how would you help some of the patients, go about navigating those costs?
We would just let them know there are a lot of pharmaceutical companies that will actually work with the patient to help assist them in the programs. It's usually the navigator's job to know which pharmaceutical companies are offering the actual assistance for biomarker testing. That's why I would definitely encourage anyone to make sure that they have your navigator as part of your multidisciplinary team, because that's the person, whether it's a social worker, a nurse, they also call them patient navigators. It's that person that's going to be able to bring you the resources and have the knowledge of knowing which companies are offering the actual patient's assistance for the programming. A lot of times it is with people that have commercial insurance, as well as Medicare. So there are options, and there are options for people that don't have insurance, where the pharmaceutical companies can still help provide biomarker testing for you. So I would definitely encourage everyone to reach out to their navigators. If you don't hear the word navigator, you should ask for a navigator so that you can have that information available to you.
Okay.
Absolutely, Angela. And also the companies that perform the biomarker testing, many of them will have financial assistance available as well.
Okay. All right. So
with your team to find out, which company is being used to do the testing, because not all companies do all testing, and then go from there. Okay. There's a lot of different options, and patients should definitely just let everyone know if they need assistance.
Okay. So essentially, don't worry about the costs, because this information is life-changing, and afterwards we can work with pharmaceutical companies or insurance companies to deal with the costs later.
Yes, even after you receive the bill like you did, the navigators can help you get all that sorted out.
Oh yeah, I mean, eventually it got sorted out, and I didn't really do that much. Like the insurance companies and my nurse navigator actually did sort that out for me, so I didn't get that bill, because when I saw it, I was just like, oh yeah, it wasn't a nice bill. So why is biomarker testing not readily available for people of color who are diagnosed with lung cancer?
I think some of the first biomarkers even that we started using were back in 2014. There are now more medications that are approved for lung cancer than any other type of cancer. And the list is growing, which is really exciting. And they'll be talking more about clinical trials and so forth in the next workshop. But there are new medications that are being studied and being approved. So this is an ever-changing field, which is great for our patients. So really just to make sure that their physician is on top of the latest and greatest medications that are available, and to ask about studies if they're interested. That's a big part of it.
Yeah, that's very true. The medication that I was started on in 2017 is that at that point in time was first-line therapy. Now you would be hard-pressed to find a lot of people who are started on that drug. I mean, granted, for me, it works, so that's why I'm still on it. But a lot of people have been started on much better drugs than what I am on right now. So you're definitely right. Every time I go to my oncologist, they're telling me, oh, this drug is being approved. This drug is being approved. So it's a lot to look forward to, that I know that at least if I fail this one, that there is something next in line for me to try.
And also keep in mind that, if a patient has a recurrence or a progression later on, that they can be retested. As was mentioned earlier, that these biomarkers can change. So in addition, with new medications coming out and the actual tumor changing, the options are going to be different.
Yeah, that's true. So how should a patient decide on a biomarker test? Are the tests done in the hospital that are more reliable than going to an outside company, or are they pretty much the same?
Most of the testing is going to be done at independent labs because they are so specialized. They have to run so many in order for quality control. Very few may actually be run in the hospital. It just really depends on that facility, but the majority are going to be done at an outside laboratory. The wait time is something else that patients should be aware of. Typically 2.5 to 3 weeks for the testing to be done. So that's important for folks to know, that they're not going to get an answer the next day.
Yeah.
Now, Angela, I know you work with Longevity, which is a great nonprofit foundation for lung cancer patients, where they can learn a lot of information about lung cancer, about the biomarkers, about the testing. We have touched upon how to pay for it and the cost and that sort of thing. I understand that you have some information that you want to share with our audience, so please go ahead, take it away.
Oh, thank you. Thank you. I definitely will. If you want to, we can go to the slide one. Yeah. Where we talk about paying for biomarker testing and a little bit about longevity and how we can help manage that a bit. If you'll go to the next slide. Of course, like Dr. Flanell said, biomarker testing is definitely something that's important and that you should ask for because it will help you get a targeted treatment. Next slide. And of course, the number one thing is the cost. A patient will say something like, well, I don't have biomarker testing ordered. I'm concerned about the cost. That's where you want to talk to your healthcare team about the cost so that they can connect you to resources that can help. The Lilly Lung Cancer NGS program with Tempest T, they have an option where they can help you with financial assistance. Next slide. And then here's my health insurance denied biomarker testing. This is where the case managers, your nurse navigators, your social workers, patient navigators can come and help you realize that there is a patient advocacy foundation. They can help with appealing health insurance decisions and out-of-pocket costs and network issues related to biomarker testing. You can get the help, request the help online, or you can call that 800 number, 800-532-5274, where they can help you sort out some of these appeal decisions as well. And I do want to take the time to say that Longevity, we can navigate patients one-on-one to help you advocate for yourself at the doctor's office, to ask for these sort of testing, know what you're asking for, educate you about biomarker testing so that you can know what to ask for when you see your doctor, especially if it's not mentioned. Next slide, please. And here's that, I got a bill for biomarker testing, I can't pay for it. There is that, you need to ask for your social worker, ask for your navigator about the bill. We have a partnership with Cancer Care. They have oncology social workers. They can provide extra patient assistance programs, supportive services. That's at cancercare.org. Or you can always call 1-800-813-HOPE. That's the Cancer Care line too, where you can talk to an oncology social worker about this. Longevity, we have a helpline as well. You can call our helpline and you'll get one of me, the social worker, or our nurse navigator as well. And we can help talk you through that and guide you in the right direction. Cancer Care's helpline is Longevity's helpline is 844-360-5864. The next slide. And of course, there are so many ways that you can learn about this and get the resources that you need. Once again, you can call our helpline. There's the Patient Advocacy Foundation case management line that can help you with the insurance issues. There's a copay relief program. Cancer Care again. Here's a pharmaceutical company with their patient assistance program for biomarker testing is Amgen. And then again, we got Lilly Lung Cancer NGS program. Next slide. And that's a lot to remember. You can always call me directly. Angela over at Longevity. That's my email there, ajames@longevity. I have my work number on there and the cell on there. We're on Facebook, we're on Twitter. We have numerous ways that you can reach out to us to get one-on-one navigation or to help guide you to your navigator at your healthcare facility.
All right, so that's a lot of information, but I'm sure that people will be sending you a lot of emails to try and get some more one-on-one information in bite-sized tidbits so that they can navigate this whole thing. I want to thank you ladies for joining us, for telling us a lot more about biomarkers. And, if you guys have any one-liners that you want people to remember, highlights, go ahead, let them know right now.
I just always tell people, just remember that if you have lungs, you can get lung cancer. But there's always resources for help. Please don't feel like you can't reach out.
Okay. All right. Great. Thank you so much. So now we're going to be going to the patient and caregiver panel. And I just want to bring on Michelle Bolden. She is the CEO for Calling for Care Impactors. Calling for Care, and she's an impact manager. So, hi, Michelle. How are you doing?
I'm good. How are you, Dr. Bart? What a great discussion you all just had.
Thank you. Thank you. Well, I just want you to take it away.
Absolutely. Thank you so much.
Nope.
Yes, like I said, what a great discussion. We're going to continue talking about biomarkers from the patient and caregiver perspective. And so again, good morning. My name is Michelle Bolden. I'm the founder and CEO of Call for Caring. And we support family caregivers through journeys such as lung cancer. We provide education, resources that help support their journey to be much better, including a podcast as well. Before I bring on our amazing panel, I just want to remind our audience that you can send questions via our chat option. So you can send it to our patient, caregivers, even the previous speakers. So we want to try to include you in this discussion as well. So I'm excited to bring on our panel, Brandy Bryant, who is a lung cancer survivor and advocate. Welcome, Brandy.
Thank you, Michelle. I'm happy to be here.
Wonderful. Deborah Carpenter, she is a lung cancer survivor and CRAS patient advocate. Welcome, Deborah.
Thank you, Michelle. And I too am very happy and blessed to be here.
Absolutely. And then we have Jennifer Carpenter, who is a caregiver for Deborah. So welcome, Jennifer.
Thank you so much, Michelle. I'm so happy to be here today. And I'm learning as much as I did with Deborah's journey, learning a lot this morning as well.
I know, right? It's just so much information we get in this short amount of time. And I'm going to ask you all to introduce yourselves and just share a little bit about your journey before we kind of jump into the biomarker discussion so we can kind of understand your history a little bit. So Brandy, I'm going to ask you to go first.
Okay. Hi, everyone. My name is Brandy Bryant. I am a lung cancer survivor. I was diagnosed at the age of 39 in 2018. I had no risk factors, but I had a small cough that I ignored for months. Honestly, it just wasn't annoying. I thought it was allergies. It turned out not to be allergies. I went to the doctor after I finally started experiencing some shortness of breath. And that wasn't even like while I was being active, not while I was exercising. It'd be while I was talking on the phone with my mom. And I'd be like, struggling to catch my breath, and I didn't know why. So that prompted me to go to the doctor. I was a busy mom of 4, so a cough wasn't anything that made me think something serious could be going on, right? But after going to the doctor, I went to my local community hospital and saw a pulmonologist there. And after a series of tests, I was diagnosed with stage 3B lung cancer. That I went through an initial chemo and radiation and eventually progressed to stage 4. And I have been on a targeted therapy and doing very well since I started that targeted therapy. And I've been no evidence of disease since May of 2018.
Wonderful.
But yeah, I did get biomarker testing at that community hospital. I was very blessed that hospital did send my tumor off for testing.
Oh, wow. That's great. So we're going to jump more into that. So I'm great that your journey ended to where you are here today. That's wonderful. And thank you for sharing that. We look at a cough could be anything. And so we just blow it off like, all of us may have a cough. So, wow. Thank you so much for sharing that. I'm sure someone learned something today just from that short amount of information. Deborah, I'm going to ask you to go next. Introduce yourself, share a little bit about your journey.
My name is Deborah Carpenter. I am a lung cancer survivor. I am a retired educator. And Brandy, my journey was similar to yours. I started with a cough. I thought it was allergy problems, so I went to my ENT. I went through several misdiagnoses of he thought that maybe I had asthma. No. My primary care physician actually did a lot with me in terms of thinking that it was pneumonia. Once the pneumonia was taken care of, the cough and everything was still there. So with his help, my next journey was getting to the Levine Cancer Center in Charlotte to get some bronchoscopies done, multiple bronchoscopies, to find out what was going on. And then after that was done and I was diagnosed with lung cancer, my new journey began. And that actually took me from Levine Cancer Center to Duke University's Cancer Center. And just so much has happened since then. I too got an immunotherapy. I actually had surgery, immunotherapy. I also had radiation just a couple of months ago, but I started out on a clinical trial drug about a year and a half ago. And I am still here because of the biomarker testing at the PD-L1 and everything that Dr. Fladon and everyone has talked about. So I'm very happy to be here and thankful.
Thank you.
I am happy to be here too.
The hope and will, I'll never forget that from Deborah, absolutely, to move forward. And so, Jennifer, can you introduce yourself?
Yes, I am Deborah's sister. I am her caregiver, her advocate, and as her doctor or oncologist calls me today, I am I am here to just make sure she is taken care of and gets all the support that she needs. So my journey as caregiver, actually, Deborah and I both had the challenge of our mother was diagnosed with lung cancer in 2005. She was a non-smoker and she died in 2007. So one of the difficulties that Deborah and I had when she was diagnosed was not seeing lung cancer through the lens of our mother's experience. This was before there were biomarker testing, so it was not a lot of treatment options in 2005. So when Deborah was diagnosed, again, it was hard to move past those expectations of what our mother experienced, what other loved ones had experienced. But along that journey, Deborah and I learned so much that it's a very different day. 15 years difference between our mom's diagnosis and Deborah's has made all the difference. Deborah's journey, as she said, it was very difficult in the beginning when she was misdiagnosed. I was just being that support for her, but as the appointments grew, as there were more doctors, more testing, I became more active in her journey. And I am just so happy to be with her today because we both learned so much together, but it was not easy. It was not an easy journey, but we're here today. I accompany her to all of her appointments. I am calling her doctors. We are checking on her MyChart accounts just to make sure that everything is as it needs to be. And I'm always fighting for her to make sure she's getting the support that she needs and what are we looking for in the future to make sure that she has what she needs there as well.
Wow, just outstanding. Oh my gosh. Deborah bragged about you in our last session, and you are exactly what she talked about, an advocate for her, a cheerleader for her, just someone to motivate her, a second pair of ears. And so that's so part of a caregiver's journey or someone's journey who needs that assistance, is to have that caregiver who is really important for them, that lifts them up. And you are such a great example of that. Thank you so much for all you do for her and being here and sharing that advocacy with others who are probably supporting someone in that same role. And so let's jump in and talk a little bit about biomarkers. I know, Brandy, you mentioned about your journey a little bit. So can you talk about with your biomarkers, tell us about how that ended up that you had the biomarkers, and did you request that, or did your healthcare provider recommend that you have it?
Yeah, so I actually didn't request it, and anyone who's newly diagnosed knows that you're thrown into a world you know nothing about, and you are in complete shock when you get the diagnosis. And so when I was, my story was very much like Deborah. They thought I had pneumonia, misdiagnosed for a while. But when I finally got to the point where I, had gotten biopsied and the results, they told me while they were telling me my results that, well, we think that it's going to be stage 3 or stage 4. We've sent your tumor off. And I just kind of remember them saying that they sent it off for testing. But it wasn't until maybe a month after that after I had time to kind of research and they were telling me treatment plans, that I even understood a little bit about what that meant. And at the time, because I was stage 3, back when I was diagnosed, they didn't let stage 3 patients take a targeted therapy. So I had to do chemotherapy and radiation first. And I had fluid on my heart, and it was a lot of drama. That's where I progressed to stage 4. But it was honestly a blessing. I knew I had my biomarker. I knew what my biomarker was before I even started chemo and radiation, but my insurance wouldn't approve the targeted therapy. So I had to do chemotherapy and radiation. The blessing was, even though it wasn't really working well, as soon as I took the targeted therapy, I was like able to walk up the stairs again within a couple of weeks, where before I was barely able to, to breathe. So I wouldn't think stage 4 was a blessing, but for me, it's worked out really well that I was able to take that medication.
Right.
But biomarkers, without me knowing that biomarker, I wouldn't be here. I wouldn't be here today.
That's amazing. And just your story just added everything that we just talked about. When to ask for biomarkers, who qualifies, and then about the money. You were denied, not knowing how to appeal. Longevity has kind of talked about that process as well. So this is, again, real life concerns that are happening, and then solutions that are being brought in as well. So Deborah, can you talk a little bit about the experience that you had with biomarker testing, and did you ask for it? Did they just do it? Did Jennifer ask for it?
After I was diagnosed with lung cancer, we had to find a surgeon because the lower right part of my lung was just not working at all. So they needed to remove that. As time has gone by, we found out that the surgeon actually sent off some of the tissue from what he had removed with the, the necrotic part of my lung, and got some results back. And then I started working with the oncologist there at Duke. And then, we had chemo, the surgery, the chemo, had not done any radiation or anything after that. But my care team is the one that suggested getting a biomarker test. I feel very fortunate that I did not have to ask for it. It was offered. We found out that there was the KRAS is my genetic mutation. So the university was actually doing a clinical trial at that time for the KRAS mutation. And Brandy, the medication that I received, I was able to sing a couple of hours later, walk, talk a mile a minute like I do now.
Yeah.
But it was it was almost like it was a miracle drug just for me. But I did not have to ask for anything. Now, my sister will continue the conversation about the bill, but whenever you're going through this, I guess one of the first questions you ask, well, I've got lung cancer, how long do I have? But do we really want that question answered? No. But all the other answers that came in terms of the testing, the medication that was available made just such a big difference. But I had been getting most of my bills paid for by my health insurance. And then after time had gone by, I got a bill and my health insurance had denied paying for it. And so we were actually dealing with the company that had done the biomarker testing. The angel on my left is the one, my sister, that actually made the phone calls, and she'll have to tell you what we found out. But I didn't have to ask for these things. They were offered to me. Right. But she can tell you about our issue with the bill and how she remedied that.
Sure, absolutely. Well, thank you. So let's talk about the money then now, because sometimes we don't want to talk about or deal with that, but that's reality when it comes to healthcare. We do have to talk about money and how we pay for some of these things. And so, Jennifer, can you kind of share the story about what happened with the denial and the payments and how you got through that?
So it's interesting hearing the panelist earlier talk about not being asked about, do you have insurance to cover this? Will there be potentially out-of-pocket expenses that you have to cover? None of that was addressed, and I'm glad, because we were focusing on Deborah is now at stage 4. This cancer spread. So when the doctor mentioned targeted therapies, and we were told about driver mutations. Again, never heard of these terms before, but we were like, just whatever it takes, do it. It wasn't until months later, a lot later, that suddenly there were the bills. From the insurance company, you get, this is not a bill, but here's a listing of all of the potential, right? And those were okay. Well, if it's not a bill, we're like, that's not a concern. There are more urgent issues that we needed to address with Deborah. But then finally, there was a bill. And I believe it was Dr. Bernard said earlier that it was not a pretty bill. And when you are fighting cancer and you are doing everything you can with clinical trials for my sister, with the experimental medication, with just dealing with all of the challenges of lung cancer, the last thing you want is this hefty bill to try to figure out how to pay. And so I told Deborah, and to be quite honest, I said, don't you pay a dime. We will call everyone. We will bring in all the resources that we need. Surely this is not your full responsibility to take care of this bill. So there were several calls made. It took a while, but between calling the insurance company, the healthcare provider, we found out the bill had been reconciled. So there was no additional payment for Deborah. Deborah had insurance already on file. We didn't even ask the specifics of what happened. It was just good to know after making those calls, there was no additional payment for Deborah. So we were very fortunate. Deborah was very happy to hear that news.
Well, that's awesome. That's a testament to all of your great work as well. Again, being an advocate in the background. Well, your main purpose is to help take care of her, right? To keep her healthy.
That's right.
Mentally and physically and spiritually. Her spirit needs to be happy, and worrying about a bill is not part of that. And so, Brandy, can you share a little bit? I know you mentioned about it was denied. Is there anything else you wanted to add to that discussion as well?
Well, I mean, I agree with Jennifer. Whenever you're fighting, you're not trying to think about the bills, right? You don't think about it, and it does take several months for them to really, really roll in. And when you're fighting, you kind of don't care about how much it's going to cost. You're not thinking about that. So I just want to say to anybody who's listening, even if they do send you bills, you can pay a very, very minimal amount while you're fighting, so that they're not sending it off to collections or harassing you constantly. You can talk to the people and tell them, I will pay you $20 a month while you're trying to work it out. And they will accept that. So that's just a little tip. But I honestly, I was fortunate that my insurance covered most of it. I did have some hefty bills, but I didn't have the capacity. I didn't have a caregiver, really. I have great family and friends, but I didn't have a dedicated caregiver. So I kind of did what you said. I'm fighting, and I just like, I'll give you this amount until I had the energy to actually really, really look at the bills and pay them. But yeah, it's a lot. It's a lot. So knowing these resources in advance can save you a lot of time. You need your spiritual and emotional energy on top of physical energy, and you can't put a bunch of time into that. You really can't. So you're really blessed that you had someone to help you. Yeah,
absolutely. And the blessing here again is that not only is that in your community, your family, your friends that's there, but other resources. And that's why we're doing this today. Longevity obviously has that background to be able to help and pull those resources in, so people don't have to go through that struggle by themselves and have that guidance. So we talked about the money and the process. Let's talk a little bit about the actual procedure, because we talk about biomarker testing. It's okay. So what happens? Is it painful? Is it invasive? What kind of happens? And so, Brandy, can you share your journey about how the testing was done?
So I know that I mentioned like there were several tests. So I had several x-rays before they figured out, oh, it's not pneumonia and it's not working. We need to do, then they did a CT exam, which is not invasive. It's, just a low dose CT. And that's where they said, they went from, oh, you don't have cancer to looking at the CT like you need a biopsy. So I had a bronchoscopy. And that's where they, went inside of my lungs and took a sample of the tumor that was in my chest. It was not comfortable. I will say that. I'm not going to pretend like it was comfortable, but I only had to do it once. And they did use a lot of drugs to, make you be calm. But they were able to use that same tumor that they used to diagnose me, that same sample, they were able to use that for my biomarker testing. I've never had to do any other biopsies. So that was my only invasive procedure.
Okay. Deborah, would you kind of share your journey with the actual testing?
Well, and similar to Brandy, for me, the surgeon who did the first step for me actually took out the samples of the necrotic portion of my lung, and we found out that there were probably 2 stages. So the surgeon had asked for testing to be done on the part of the lung that he had taken out, but we think that the oncology team later also knew that they had kept a sample of that tissue as well, and then that team is the one that requested that we do a biomarker testing for something a little more definite, and that's whenever they found out that there was a KRAS. So I never had any type of invasive treatment at all other than the bronchoscopy, but that was in the identification as having lung cancer to begin with. But after that identification, I never had anything that was invasive at all.
Okay. Good to know. Jennifer, is there anything you want to add from a caregiver perspective, even maybe what you were told about the testing? Did you have any education about it, or did you just get the results and have to learn after the fact?
I spent a lot of time searching. Google searches, American Lung Cancer Foundation. And so I knew about targeted therapies, and I knew that testing was needed for that. But you're learning so much. You're hearing words and phrases that you just don't fully understand. So I didn't know exactly what that meant. It was after Deborah was diagnosed with stage 4, and we knew that there was a driver mutation testing. We knew that there was this KRAS genetic mutation, and it was at the clinical trial stage actually for Deborah, where initially, because there was no medication, there was no KRAS mutation at that time, but there was a clinical trial that was testing that medication. And Deborah was not planning initially to participate in the clinical trial. But when the clinical trial nurse asked us what other options we would seek, that's when we talked about immunotherapy, and she told us about a biomarker testing, the PD-L1 score. And again, we only knew a little bit about what that meant, but she explained that this lower PDL score meant that maybe immunotherapy was not the best treatment for her. So when we learned that information, and that this clinical trial would be targeted to her cancer, that's when we started looking up more information about biomarker testing, driver mutations. What does this mean? And so for Deborah's journey, we had to learn about that ourselves and do all that research ourselves. But we did have a really wonderful PA that explained in more detail what driver mutations were. And then again, the clinical trial nurse explaining how to apply that information, that PD-L1 score, maybe there were some other treatment options better for her, which it was all of that information that led to the clinical trial, the decision to participate in the clinical trial.
Wow, that's awesome. It's so much information we're thrown in into when you come into this journey. There is a benefit of having Google and searching, etc., but it's much more beneficial when you can talk to a provider who knows your case and is very specific about your journey, so that it can explain exactly what's happening to you and your family. And so that is another important part of the team. And I know Angela mentioned about the healthcare team, and we'll talk about that a little bit more. But it's so important to have all those members of your team, not only your family, but also the healthcare professionals as well. And being able to explain that alphabet soup to you, that ABCD that we so often just throw out, and people are like, what are you talking about, right?
Yeah.
And so it's great to write down those questions as well. And now one last question before we jump into our next panel, or last couple of questions. So how long did it take you to get your biomarker testing? And Brandy, I'll let you answer that first.
So for me, it was about just like Wendy said in the previous panel, it was about 2.5 to 3 weeks.
Okay.
that I before I knew what my biomarker was, and I'm ALK positive. And one thing before we get off of this panel, I do implore people, if you're newly diagnosed, to please know what your biomarker is, because I'm ALK positive, and my initial treatment plan was chemo, radiation, followed by immunotherapy. At the time, they did not know that immunotherapy does not work on ALK positive patients. So if I had taken the choice, and the tumor board at my very great hospital here was split between whether I should do, when I progressed, whether I should do immunotherapy or targeted therapy. Thankfully, I had done enough research by the time I progressed that I knew that I should not do immunotherapy. And I'm very, very thankful that I didn't. So biomarker testing can not only give you improved treatment, it can actually really save you. Like, I should not have done immunotherapy, and I'm thankful that I didn't. It could have made my treatment journey much harder and much longer and much more difficult. So know that biomarker. Like, no matter what, you need to know your biomarker.
And so when they provided you with your test results, did they kind of explain what that meant for you? And was that
they explained it to me. They told me that that meant that I could take the targeted therapy, but at the time, as I mentioned before, I was stage 3B, and insurance wasn't going to pay for this medication that was only approved at that time for stage 4 patients. I believe now it's approved for stage 3 and above, but at that time they weren't going to pay for it. Yeah.
It's just important that they give you the results, but it's also important for you to understand what it means, right?
Exactly.
And so if you have no idea the importance of biomarkers, it doesn't do a lot to get the results. And so, Deborah, can you share your, how long did it take for you to get it back and that conversation?
It took 2 to 3 weeks to get my results back as well. One of the things that, Brandy, you had mentioned, the immunotherapy. The immunotherapy was recommended to go along with the clinical trial drug. Although for me, my body, it reacted negatively. It started attacking itself. So then I had other issues that occurred. But once we, finally didn't have to do any more of the immunotherapy, and it was just the clinical trial drug, that is when I learned, thank God, that I had hope with him, and this medicine gave me hope, gave me a chance, and it gave me the opportunity to be here today. So my journey is very similar to Brandy's, except for having experienced the immunotherapy and the negative reactions with that. But people have got to try the clinical trials. You've got to find out your biomarker. Mine is KRAS, the KRAS mutation, and I am a member of the KRAS Kickers. And we have a large group of people who are working to just kick KRAS so that we can keep on living and keep on giving. So I'm happy to be here, and thank you.
All right. I love that, KRAS Kickers. That's an awesome name. I just love it. So it's a noun and a verb, right? So we're going to kick that. That's right. So, and Jennifer, did you have anything to add, particularly when the results were given, to be able to absorb and receive that information? Anything you want to share to that?
I would say, and Deborah's journey is so tied to the clinical trial with her, because again, there was no medication for that mutation, the KRAS mutation, at that point. Luckily, we are so lucky that the academic research hospital where she was being seen at Duke, they said there is no medication, but we have a clinical trial, but we need for you to wait. Because it had not begun, and it was going to be a few weeks before it did begin. That was a very difficult time because Deborah's health was rapidly declining. She had to be seen by a pulmonologist. She was put on oxygen while we waited. It was a difficult time. It happened over Thanksgiving, and it truly made us have to navigate Thanksgiving with our brother and his family very differently that year. But once we did have that information, and again, Deborah said yes to the clinical trial. That didn't mean that she was in the clinical trial. It meant that she was saying yes to, she was willing to go through the screenings to see if she was a match. It meant that we then received the study protocol for how this clinical trial would be administered. And that is when I put my research hat back on and learned so much about this KRAS mutation. There wasn't a lot of information out there, but what I did find was very positive about results in clinical trials. And that information being out there, even though it wasn't much, that information really helped to inform the decision to then participate in the clinical trial once Deborah was considered eligible to enroll.
This has been such a great discussion. And as I listen to all of your stories, and just as you completed your thought, Jennifer, and just Deborah, just hearing your journey compared to what your mom was completely different. And so when you opened the door, you thought, here we go down the same path. But yeah, you went down the path and you opened your minds to new things, which allow for Deborah to have a life, longevity, right? And what she has right now, to clinical trials, in which traditionally we're not a part of. We've had some bad history with clinical trials, right? And so opening your mind, opening your ability to have that longer relationship with your sister. And it sounds like a bonding that has just been unmatched moving forward as well. So thank you, Brandy and Jennifer and Deborah, for just sharing your journeys. I'm sure people learned a lot and are very motivated from what they heard today. And so now we're going to add on our speakers to wrap up our final panel. So we'll bring back on our speakers. And as they're coming on, we're going to remind, if you have questions, you can certainly add them to the chat box, and we'll try to include those in as well. So welcome everyone back. And in our last part of our conversation, I'm going to start with Dr. Flanall. Dr. Flanall, earlier you mentioned about qualifying for targeted therapies, and so did our other panels talk about that a little bit. So can you talk a little bit more about what's qualifying for targeted therapy, and kind of what are those factors that are involved in that?
I think one of the biggest factors, and some of the other panelists mentioned it, is whether or not what the results of your biomarker test show, and whether or not there's enough levels or enough markers present to show that you would benefit from having targeted therapy. An example, I mentioned the PD-L1, is they look to see what percentage. If you have a high percentage of the cancer cells express the PD-L1, you'd be a good candidate for the target. If you have a low percent, less than 10% of the cells express it, then it would not be beneficial. And then you've heard mentioned, and I'll let them comment a little bit more about, KRAS and ALK, and some of the therapies don't qualify for immunotherapy. So that's what I mean by qualifications, whether or not the targeted therapy is going to benefit based on the marker results that you have.
Awesome. Thank you. That absolutely provides some clarity for us. Wendy, can you tell us about, heard this terms a little bit, but what does precision medicine versus personalized medicine mean to you?
It's a little bit overlapping, and then that's what I like to explain to patients that the whole idea behind, molecular testing and biomarker testing is that it is personalized to you. Precision medicine is really in the lab and that we're finding these markers and so forth, but it is personalized. And one of the ways that I like to explain it to patients is that, if your tumor is wearing a blue hat, we're going to give you a medication that responds to blue hats. Likewise, if it has red socks, we have medications for that too. That's an easier way of saying that it's personalized to them. I think of precision medicine, like I said, just being in the lab. But one of the things that I really wanted to share was that longevity has excellent information. I know folks turn to Google. There's a lot of information out there, but they have excellent newly diagnosed information, biomarker testing, everything. So I really encourage folks to look at their website to find good quality, up-to-date information. It's important for information to be up to date because as new medications are approved.
Yes, that's what I said. Google can be a good thing and maybe sometimes not so good thing. So it's great that we have these resources here today where you can go back and get much more accurate and current information because as you're hearing here, things are evolving in the treatment of lung cancer. So Angela, I want to add you just to the conversation and talk a little bit about, earlier you mentioned about the nurse navigator and the importance of them as being part of the healthcare team. Can you talk a little bit about other folks who should be part of that team and also as it relates to cost, who needs to be advocates for you as well when we talk about cost?
Yeah, definitely. Nurse navigators, social work navigators, you need support. It would be good to have support groups for the patient as well as the caregiver, because that's just going to add more to your team. You're physically being treated for cancer, but there's a mental side as well to have to deal with. So it's very good to have someone that can address all those issues for you. And as far as the cost and the testing, I was listening to Jennifer talk about making all the calls and all of that. This is where you can lean on your navigators, and they can kind of provide that relief for you, because I know as a caregiver, you're not really worried about bills, but that's something you have to address because you're trying to take care of your loved one. So navigators try to be out front for you to help you be able to focus and concentrate on that. So I would encourage everybody to lean on their navigators. And like I said, they can be nurses, but they can be social workers. They're called patient navigators. And I just would stress the support that they can offer you.
Thank you. Absolutely. And, Brandy, I know you mentioned a little bit about your support. It may not necessarily come from family or friends, et cetera, who are there a little bit, but can you tell us what support systems did you use? Did you use support groups in order to kind of help you with your journey?
Yeah, definitely. I still used family. I just happened to divorce right before I got diagnosed, but I had family, tons of friends. I had a great community. I had people bringing meal trains to the house and watching the kids. But what was most helpful, honestly, were the online support groups when you're newly into this. And there's so much stigma, which we talked about in one of the other panels with lung cancer, that it's hard as a young woman to kind of come in like, I've got lung cancer. So finding a group like Longevity, I did connect with Longevity and other lung cancer organizations, and even my biomarker specific lung cancer organization was very helpful. And one thing I tell people now, like, and when I meet newly diagnosed folks, I ask them, get yourself a therapist. You need therapy right away. It took like a year before it would knock me on my head, like, oh my gosh, I was diagnosed with lung cancer and I just went through all of this. And so it's a lot, and it's important to take care of yourself in that way. But yeah, having all of these kind of levels and layers really helps build you up as a patient. You need hope and you need strength in multiple ways.
Absolutely. And, Deborah, I'm going to ask you to kind of talk a little bit about the crash kickers as we wrap up here, because that's another means of support, that people can utilize on their journey.
I found out about the KRAS Kickers group after I had gone through all my treatment and was beginning to survive. Just finding another group or a group that was focusing on the same mutation that you have made a big difference. Listening to people discuss it. I mean, it's kind of negative that your focus and your commonality, your common thread is a genetic mutation, but you have that common thread where you can talk about it. And that made a big difference. And I know my sister made the comment that at first I was not going to do the clinical trial. And I think for the African American population, we still think about the Tuskegee experiment. And I guess I'm 66 years old, so we think about the fact that, was there a placebo? And with that group, there was not a placebo. So when we think about what happened there, that can sometimes be a stigma. And then a lot of people don't want to talk with you about any type of cancer. And depending upon the gender or the age, or whether it's a rural area or an urban area, people still whisper about the cancer that they have when we need to talk about it. So that's why I love the group KRAS Kickers. Not everyone has the KRAS mutation. There are others, but it's a forum for us to discuss our cancer and to discuss the survival that we are all seeking.
Oh, that's awesome. And not the support, but also action behind it. It sounds like there's call to action in what you do that can impact everyone on their journey. And so before we go, I'm just going to take maybe one or two questions from our YouTube and Facebook audience. And so we do have a question from our YouTube audience. It looks like this is for you, Angela. Is the financial assistance based on a patient's income, or is it healthcare need basis?
They do have income guidelines, but they're very generous with those guidelines. You think 250% of the poverty level, 150%. When you start dealing with the insurance companies, they can go all the way to 500%. And that gives you a little bit wider angle for more people to be eligible. And a lot of times they want you to have commercial insurance. So that tells us right there, a person that has commercial insurance and are paying for that and still could be eligible, that's letting you know how generous that they can be. I would urge people not to say, well, I'm not eligible, I'm not going to try. I would say, please approach it because they are very generous.
Okay. Awesome. Great answer. And then we'll take one more question from a Facebook audience. Do most communities know what to ask for, what type of lung cancer they have? And I think I'll give that to you, Dr. Fanal. Do they know what type of lung cancer they have? Do they know to ask?
I think that the physicians commonly know. It can get a little bit complicated. I think an easy way to think about it is there a small cell or a non-small cell, and then you can branch from there. But I think that's the importance of having sort of outreaches like this, right? So we can get the word out so that they know to ask. What type of lung cancer do I have? Is there opportunity for biomarker testing? What type of therapies are available to me? And we get this information out. We do these educational pieces, and if they don't know, hopefully after today they do know.
Absolutely. That's a great answer. And that's a great way for us to wrap this up. But I believe that the information that was provided today covered all those many issues around biomarkers, what it is, the need for, the importance of it, and what it can do in a journey for a patient and their caregiver as well. So I just want to thank each of you all for this outstanding panel, for sharing your expertise, your journeys. And we certainly appreciate your work and your advocacy and just your willingness to share and empower others through this education that we're doing today. And we'll wrap up in next month. So thank you so much. And I'm going to hand it back over to Pastor Eddie.
Thank you again, Michelle. Thank you, Dr. Fanal. I can't say enough to Wendy and Angela for your expertise and what you've brought to the table today. But Brandy and Deborah and Jennifer, when I tell you that the testimonies that you have given were so enlightening, I was sitting here and multiple times I just got filled with emotions because our community often suffer in silence. suffer because information is not out there and it's not given. They just don't know, Dr. Fanal. And I think, as you said, because of these type of workshops, because of these type of educational series that we've been doing, I believe lives are going to be saved. Lives are going to be changed. Lives are going to be even healthier because of the information and testimonies that you've given. I wish I could just reach out to you, Brandy, and just hug you, and Deborah, and just love on you, because I know that our church here in Metro Atlanta, we have a very young congregation. We're very technology sound, but I know that often the calls that I get breaks my heart, because it's really about the information. Self-care is the best care, but part of self-care is education. If you don't know, then you can't care for yourself. And so thank all of you for what you have brought to the table. And I'm going to spin this thing just a little bit, because I got to tell all of our listening audience, those that are on Facebook, Instagram, those that are on our website, you should not, absolutely should not miss the September 3rd event. When you listen to these testimonies, we're going to be live on the radio. Over 5 million people are going to be listening in to this type of session, and your participation is absolutely necessary, because why give out all this information if nobody hears it? And if you don't hear it, you can't use it. Well, the Hill Collaborative, along with Impact Church and all of our sponsors, and I cannot say enough about our sponsors, it's because of what you do and the resources and funding that you have brought to the table that we're able to give out to do these type of workshops and give out this information. Know this, you're blessing a community that otherwise would never have heard. Can I just say personally, I've not experienced lung cancer, but I have ministered to so many people who have, but I would not have known the things that I know now about lung cancer, its diagnosis, biomarker testings, what is the type of lung cancer you have. I wouldn't have known any of these things without the help and the assistance of these individuals, these amazing individuals that have come to the table and have brought their gifts and graces to bear for all of us. And so thank you to all of our sponsors, Amgen, Hill Collaborative, Morehouse School of Medicine, Northside Healthcare Systems or Hospital, Emory Healthcare Systems, all of the clinicians, and all of you who make these workshops more valuable to our community. Listen, I told you earlier that we are going to have a giveaway. Those giveaways you're going to be, if you've registered, if you liked Hill Collaborative on Facebook, if you've shared it with your friends, know this, that in 2 days you could be notified that you're the winner of the Walmart gift cards. But know this, even beyond that, on September the 3rd, we're going to be giving away even more great surprise gifts. So I encourage you to be on campus, Impact Church at 2323 Sylvan Road on September the 3rd, because we are going to be having a community conversation about lung cancer and its related illnesses. It's going to be live on WAOK, on V103 and their partnerships. We're going to have health vans out there. We're going to have individuals or clinicians and neurologists that are going to be giving out information. We're going to have policymakers there that will tell you about what's going on the legislative platform that you can be involved in. Your voices count. You matter, and you are worthy, and you will not suffer any longer in silence. Come out, be a part of it. And if you're not local to Atlanta, tell a friend about it. Tell your neighbors. Tell your Facebook friends. Tell your Instagrammers. Again, I'm not a social media person, so I don't know the real names of all this. So y'all got to bear with me on this. But the resources are here for you. Impact Church is creating a resource manual. It will be both an electronic manual as well as a virtual manual housed on our website. You can click onto it and get all of the information you've heard about today. There's links to longevity. There'll be links to Heal Collaborative and some of our other partners that you've heard from today. If I were you, I would not miss this opportunity to get educated and heal. If you heal an individual, you'll heal a community. So let's do it together. And until we see you all again, know this. Join us on September the 3rd for our final part here at Impact Church, a community conversation on lung cancer. Keep your eyes open for our next post of the event. It's so big that I can't even tell you all about it. The American Cancer Treatment Center, the Cancer Treatment Center of America. I'm going to get it right after a while. The Cancer Treatment Center of America is our partners as well. They will be on there. Thank you all for participating. This was an absolutely fantastic hour and a half. I thank you for taking out your time. Know this, September 3rd is Labor Day weekend. So you're going to have a long weekend. So come and share with us for 1.5 hours if you're virtual, or 4 hours on site. We're going to have vendors that's going to have popcorn. We're going to try to do it healthy. We're going to have popcorn. We're going to have ice cream. I don't know about the healthy part on that, but I love ice cream. I really, really love ice cream. And we're going to have a lot of wonderful veggie options for everyone. We are excited here at Impact Church. I am so honored and pleased to be the care pastor here, and I serve you with all of my heart. Please tell people about it. Tell your neighbor, co-workers, your family, your friends, because we want to help save lives and thereby saving communities. God bless you and keep you. That's our prayer until we see you again. I look forward to it. Thank you.